Hello and welcome to the Going Digital Behavioral Health Tech Virtual Conference. My name is Dr. Julia Hoffman and I'm Livongo's Vice President of Behavioral Health Strategy. Today, I'm excited to welcome IU Health Director of Healthy Results, Tammy Smith. Tammy has an extensive healthcare background and leads Indiana University Health and IU Health Plan's nationally recognized employee wellness programs. Today, Tammy's going to discuss IU Health's strategy to address mental health and wellness and how they leverage Livongo for behavioral health powered by MyStrength to offer their employees additional digital support. And then I'll describe Livongo's MyStrength program and how our full spectrum digital behavioral health solution delivers measurable results for clients and members. So welcome, Tammy. Please take it away.
Thank you. It's a pleasure to be here. Again, my name's Tammy Smith. My background is in nursing. I'm also a certified wellness coach. So I'm really passionate about wellness. I'm excited to talk to you today just about some of the things we're doing around emotional health and well-being at IU Health. So IU Health is obviously located in Indiana, and we have about 34,000 team members that we offer wellness to. We also have about 18 hospitals statewide. Additionally, IU Health Plans is offering a commercial and a Medicare product, and our Healthy Results Wellness Program supports those members as well. Healthy Results and IU Health have been recognized as a 5-star Achieve Well winner by the Indiana Wellness Council, and we've also been nationally recognized by the Healthiest 100 for 4 years running. So why is mental health an important topic? Well, depression has a high financial cost, and it ranks in the top 5 of disability claims globally. Depression is the leading cause of disability in the US, impacting absenteeism and productivity. And 1 in 10 people struggle with it. There are more missed days of work due to depression than chronic illnesses like arthritis, asthma, back pain, hypertension, and heart disease. Depression and anxiety are especially troubling among our millennials, with 1 in 5, which is higher than any previous generation. And at IU Health, we're working to reduce the stigma and offer programs that address mental and emotional health. So why is it important to us here at IU Health? I love this quote that says, hospitals are labor-intensive organizations whose employees consume about 20% more in medical services than typical employees of other industries. So depression and burnout are significant concerns in the workplace with a high financial and human cost, but healthcare is especially vulnerable due to the nature of our work and the emotional demand required. Healthcare is really hard, but it's also a calling. And so our team members really believe they're a part of something bigger than themselves, something really meaningful. And in order to make a difference and do that meaningful work, it's really important that they take care of themselves and each other, and that we as an employer are there to support that. So let's talk about a little bit about the significance here at IU Health and the impact. According to our aggregate survey results, we're seeing a rise in depression and anxiety, and those rates are higher than the national rate, which is around 10%. So self-reported active anxiety is around 18%, and active depression is being reported at 15%. Additionally, when you look at major work and life changes, over half of people report that that's significant for them. And if you think about healthcare, and if you even think in recent days, the changing environment, the pace of change, work and life changes, that's just common, and it's not going to go away. But there is good news. We know that depression is treatable. And if you'll advance, that more than 80% of people show improvement with treatment. And treatment is also helpful in reducing absenteeism and presenteeism. So knowing that, we decided to focus some energy and some of our programming on improving mental health. So we set some goals. And our first goal was to reduce the stigma. We hosted leader training sessions to really talk about the prevalence of depression and anxiety in the workplace. And we walked our leaders through these tips on reducing the stigma. So first of all, to create a trusting environment. And that kind of leads to the next bullet point of we do that by getting to know our team members on a personal level. So we talked a lot about personal vulnerability and professionally, but adding that concept that the more you get to know your team members, the more you'll be aware of the changes that you're seeing. And so how that early recognition is really important. And then asking supportive questions. So that might sound like, I've noticed you've been absent a lot lately and that doesn't seem like you. So I'm kind of worried. Is there anything that you'd like to talk about? Then we distinguish that your role is not the counselor. Your role is support, to listen appropriately and then guide to resources. So you can't guide them if you aren't aware of them. So we really worked to help educate our leaders on what resources are available to them and how to access those to support the team member. The second goal was to expand our online resources. So when you think about the significance of the problem and the prevalence of the problem, even having some good resources in place, we still needed a way to scale and improve access. So online resources seemed the natural next step. And I've included some additional ones here for your reference. These were helpful to us as we were developing our strategy. Right Direction for Me is a nonprofit organization, and the Greater Good out of Berkeley has really some tremendous resources. So in February of 2018, we partnered with MyStrength and we launched the digital self-care tool, and Julie is going to tell you a lot more details. But what we liked about that was the ease of access, the confidentiality, and the scope of the services, to everything from managing their stress to coping with depression and anxiety, all the way to getting support for difficulty with drugs or alcohol. So then our third goal was to increase our mental well-being programs. And I want to highlight just a few of those. We've really made a concerted effort. One of them would be our provider burnout. We were really trying to address this issue, and that's really a significant one for us in healthcare. So we developed steering committees. We utilized the Wellbeing Index out of Mayo. We had some focus groups around the EMR and how to streamline that, make that better. And we also hired a chief wellness officer for the physician groups. Additionally, we expanded our mindfulness groups. We have improved our partnership with EAP for cross-referring. And we also developed a lot of webinars, again, to reduce stigma, to educate and build awareness. And obviously, MyStrength is on that list. So then, despite all of this great programming, the 2020 pandemic brought this need even more to the forefront, and especially of our leaders. And so out of that, we have had a lot more concerted effort with a centralized virtual behavioral health hub. This is a centralized phone number that team members can call and get triaged to the most appropriate resource. We have a team member support committee with broad representation across the organization, including nursing, EAP, chaplaincy, behavioral health, wellness, and the executive team, to identify gaps and elevate our existing resources. And then as a health plan, we made the decision to expand MyStrength to all of our members, regardless of if they had the wellness program, which allowed us then to expand that to both Medicare and commercial members. And MyStrength and Livongo were just so responsive to making this happen really quickly and getting that stood up in light of COVID. And our Medicare signups to date are showing really strong numbers, and we're super excited about that. So here's just a little bit about our outcomes with the MyStrength tool. We've seen some significant clinical improvement with 68% of people utilizing the tool, having improvement in those symptoms in the last 6 months. And then at 64% since inception, which again was February of 2018. Additionally, our utilization has really surprised and delighted us, and we were encouraged that our recruitment goal, we exceeded that by 2.5 times in 2019. And significant, I think, to that is this idea of a wellness challenge. So we run system wellness challenges, several a year, and some of them have been in the emotional well-being space. So challenges like mindfulness, gratitude, strengths, knowing your strengths. And when we link to the MyStrength tool, we saw in June alone an increase in enrolled members by nearly 25%. So that's been a real key to our success. Finally, I want to share just a real life example with you. So this is Mary Lou, and you know, life happens. 2 decades of coping with her mother's Alzheimer's disease really took a toll, and she called Healthy Results to help get her life back on track. The longstanding stress had packed on an additional 65 pounds, and she knew it was time for a change. Her wellness vision included digging deeper into establishing a better life balance, staying positive, and maintaining both her physical, mental, and emotional well-being. She worked with a health coach to lose weight, as well as use the MyStrength platform to help her work on her mindset. And she has found that focusing on happiness and gratitude have helped her to rediscover herself. Above her desk hangs a saying that she found on the MyStrength website, and it says, "Never discourage anyone who continually makes progress, no matter how slow." Mary Lou told us it's a note to myself to remind me to be compassionate both to myself and to my coworkers. So I'd agree with Mary Lou that she's certainly taken her life back. So stress and mental health are not just personal problems. These are workplace problems, and we as an employer have chosen to support our team members through a variety of both high-touch as well as virtual programs to help support their overall well-being. So thanks for the opportunity to share with you some of this important work, and I'm going to hand it over to Julia to tell you more about the platform.
Thank you so much, Tammy, for sharing those incredible results and for being willing to help us to sort of explain the opportunity of digital behavioral health tools in general and how important they are in various settings, including employer settings. So my name is Dr. Julia Hoffman, as I said at the beginning, and I'm Vice President of Behavioral Health Strategy at Livongo. I'm coming to Livongo via the federal government, where I was most recently National Director of Mobile Health for mental health and suicide prevention. It's obviously a very big job because the VA is the largest integrated healthcare system in the country with a big focus on mental health. So we can go to the next slide. When I came to work with Livongo, it was in the context of wanting to understand with them how to address the behavioral health needs of individuals with chronic conditions. Livongo is world-leading company in chronic condition self-management, so helping people with chronic conditions live better and healthier lives, starting with diabetes and then expanding out into other chronic medical conditions as well. And ultimately, in early 2019, we decided to acquire MyStrength, which is the platform that Tammy just discussed and that has been around for almost a decade at this point. So although I'm introducing it to you today as a piece of Livongo, this is a very well-established and mature platform. When I think about the key affordances of MyStrength, really it comes down to the top 4 that you saw on that last slide. And I'm going to go through each one of them one by one here: scale, breadth, personalization, and results, so that you can understand kind of what we see as important, what I see as important, having spent as long as anybody in the digital behavioral health space. I've been on this team since the beginning. So let's jump right in and understand a little bit about what's important here. So first of all, scale. We can go to the next slide. Thank you. First of all, scale. I think that the interesting thing about behavioral health is that it lends itself incredibly well to digital platforms because in some ways it's easier than parts of medicine that require biophysiological measurements, eyes on a patient, hands on a patient especially. Because for us, our interventions are our words in clinical psychology. And so because of that incredible opportunity, it opens the door to a tremendous amount of innovation. And so really one of the critical things for us was looking at scale and looking for a solution specifically that had been rolled out in a variety of settings that showed the appropriate sort of recognition of the challenges around privacy, security, around accessibility for people of all different abilities. And so really my strength, as I said, been around for almost a decade, has served many providers, payers, Medicaid plans, as well as a whole bunch of more novel platforms and new sort of startups such as Lyra or Castlight. We can go to the next slide. One capability that Livongo, so Livongo has an incredibly deep data science bench. And is the applied health signals company, which means that we use AI and machine learning to power all of our solutions in order to optimize them at every stage of use. So on the very front end, pre-enrollment is where that starts for us. And this is a capability that Livongo has added to MyStrength since the acquisition especially. So one thing that's relatively well known about behavioral health solutions is that as much demand as there is, and as Tammy mentioned, that demand has only increased and increased in 2020 so far, that the enrollment is typically a lot lower than you would anticipate given the pent-up need that we see. And so one of the key capabilities that we've got here is to outstrip typical EAP enrollment by about 3 to 5x. We have a couple of different ways that we do that. One of those is through Livongo's sort of proprietary AI engine that powers our enrollment marketing, so we understand who to offer services to, who to send more information to, and how to optimize the messaging that we send to those folks so that they really can identify that the tool is right for them and how they can best get engaged quickly and easily. In addition, the other one I want to highlight from here is the claims plus model that we use. So what we know about behavioral health is that most people who need help for behavioral health, and Tammy mentioned this, are not actually seeking it. Even if they're seeking it, they don't necessarily receive it. So about 60% of people who need help in behavioral health are not actually receiving any care. There are a lot of reasons for that, including stigma, including low health literacy. People literally don't understand that they have a problem, and better yet, a treatable problem in a lot of cases. And so what we can do now is use these proprietary algorithms that we have to do an assessment of claims, including pharmacy, including all healthcare utilization claims, and identify the individuals who may benefit from behavioral health tools, who may not have a behavioral health diagnosis in their chart anywhere, who may not have sought behavioral health interventions in the past, and who may not even have ever used psychotherapeutic medications. So we are continuing, obviously this is how machine learning is, that just continual advancement. We're continuing to hone that model, and we're really excited about the results that we're seeing in terms of the utilization and our ability to offer access to as many people as need it. We can go to the next slide. So I do want to talk about breadth, because I think that this is a really key element of the MyStrength platform. we look across breadth in a couple of different ways. The first is in terms of severity and acuity. So the numbers here from healthy, subclinical, clinical are actually the percentages of users in the MyStrength platform. So this represents what people actually score on their baseline assessments coming in. We've got about a third of folks who are healthy and just looking for tools to increase their resilience. Folks who fall into the subclinical zone, which means that they don't actually have a diagnosable clinical condition, but they may have enough distress, relationship distress, work distress, parenting distress, that is really impacting their quality of life or ability to show up for the things they need to show up for in their lives. And then the clinical group who have any of a number of clinical conditions, but who fall into at least one fall into a clinical range. So we serve this entire spectrum. And the important thing here is that you'll notice sort of intentionally that the lines between the categories are dotted. The gradient across them is indicating we all fall into one of these categories at one time or another. Behavioral health is different than other chronic medical conditions because it's more episodic. And actually what we're seeing right now with COVID-19 is that the whole spectrum has just shifted a little bit further towards the left. So we can go on to the next screen. Thank you. So another way in which we offer breadth is that we have a whole variety of focus areas and different evidence-based paradigms. So you can see 16 different core focus areas here, ranging from the usual suspects like depression and anxiety through things that are a little bit less common to see, like substance use, chronic pain. Certainly we have some that are for subclinical folks as well, like a whole program on stress, a program on how to manage the stress that's secondary to chronic conditions. That's a very real thing and a very has very significant impact on people's ability to self-manage. We'll talk about that more in a minute. And then additionally, topics that are for specific populations that have unique stressors, like folks who are pregnant or engaged in early parenting, people who are in the LGBTQ+ community, etc. So just a ton of focus areas. And then additionally, because we understand that treatment is not one size fits all, we have 8 different evidence-based paradigms that are at play in the platform. So largely these fall under a cognitive behavioral umbrella, but we do really have a whole bunch of mindfulness-based tools and exercises. We have acceptance and commitment therapy for helping people to identify their values and to proceed in the direction of wise actions. We use motivational interviewing, especially in the context of substance abuse, positive psychology, especially for folks who are in the subclinical or healthy range, etc. So what our platform is able to do is to offer these 1,600 plus activities and to structure and restructure them differently, just like a therapist would do. We can go to the next slide, which talks about personalization and starts to talk a little bit about how we do this and why it's so important. So evidence-based protocols do not work without sufficient personalization. I sometimes give the example that Advil is an evidence-based protocol for headaches, but it's not an evidence-based protocol for cancer. Just because something has evidence associated with it doesn't actually mean anything outside the context of what you're trying to treat. In psychotherapy, that message gets lost sometimes, especially because CBT has a lot of evidence for a lot of different conditions. So sometimes that message gets confused. But realistically, if 2 patients walk into my office, to my clinical office, having the same depression scores, the same anxiety scores, that doesn't necessarily mean that the treatment plan for those 2 individuals would be the same. And in fact, my relationship with each one of them, my understanding of who this individual person is, what they're willing to work on, what they're ready to work on, what's getting in the way for them specifically, all of that impacts the treatment plan that I would select for them and that I would iterate on over the course of our work together. So we've tried to replicate a good deal of that in the MyStrength program. And there are a lot of ways that happens, explicit and implicit. What you see on the screen here is a personalized pathway. and an example of how after each exercise, after each activity, we ask how helpful the activity was for the individual. That's just one of the inputs. We additionally understand when people stop using activities. We understand when they skip things. We look at people who are similar to them or who are having similar challenges, et cetera. So there's a lot that's baked into our model for constantly personalizing and trying to get the right activity to the right person at the right time. We can go to the next screen. An additional option for personalization is that for many of our clients, we offer dedicated coaching that's asynchronous. The goal of our coaches is to enhance engagement. Our coaches are not doing therapy. What they're doing is ensuring that an individual member gets an adequate dose of the actual active treatment, which is the website itself or mobile app. So I should say that my strength is a website. It's responsive web. It can be used on any surface. And additionally, we have native mobile apps. The coaching also can be used in any of those venues. If you do select to have a coach, 100% of members are assigned a coach. And then about 35% of them choose to actually actively engage. Interestingly, even those who are offered a coach who don't engage do get a little bit of an engagement boost, because just social psychology principles push us towards believing if there's a person somewhere in the system that you will be a little bit more connected to it. But for those who do engage with a coach, we see 3x engagement with the digital platform and subsequently a 1.5x clinical improvement above individuals who are not coached. So we are able to improve upon our results by keeping people engaged and decreasing attrition that plagues every digital behavioral health platform. We can go on to the next slide. We do have results. These are my strength results specifically. I do often focus, and I'm sure other speakers have focused on the fact that there are plenty of peer-reviewed reports at this point that show that digital behavioral health tools really do work. Not all of them, not all of the 10,000 apps in the App Store of high quality, but many, especially those that are from trusted sources. And so My Strength has 6 peer-reviewed publications, about to be 7, 18 case studies, 14 white papers. We've done a lot of work to see that we really are having a really profound effect, as Tammy was sharing in her own population, including in 55% reduction in depression scores, which was 3 times better than an active control. And that we found that the My Strength platform in the wild is about 82% as effective as face-to-face therapy, which is incredible. We did a novel study with the state of Missouri, their Medicaid population, and found an incredible ROI of $382 per user, additional claims cost reduction across all claims. We can go to the next slide. So in the context of Livongo, a chronic conditions company, we really see our individual members as whole people. And what we want to do is make sure that we leverage our behavioral health programming in an effort to serve individuals with other chronic conditions as well, in order to help them to live their best and healthiest lives. So what you see here is an example of our glucometer, our blood glucose meter. Every time after you take a reading, you can use one of these feelings tags. The one that's selected here says that the person's feeling stressed. And if we see a pattern in your level of stress, then we will send a health nudge that says, hey, it seems like you've been stressed a lot recently. Would you like access to a digital tool? If they say yes, then we can push them directly to our My Strength platform. Additionally, our coaches coordinate behind the scenes so that we can understand that an exacerbation in symptoms on one side of the house can actually be driven by the other side. And so we want to make sure that we're well aligned on that at all times. And we enable our coaches to do that behind the scenes. We can go to my last slide. So we just recently published a blog by our Chief Medical Officer, Dr. Bimal Shah, and we have a peer-reviewed article coming on a really cool study that we did on the interplay of stress and diabetes. This is incredibly important to our population. And what we found was using those feelings tags that I just showed on our blood glucose meter, we found that about 55% of our participants were experiencing stress at the time of their blood glucose readings. And that ultimately, the higher the stress, the worse people's glycemic control was, which is really, really problematic. They had higher BMI, they had a longer duration of diabetes. And so we're starting to make these connections to understand the very, very deep and important relationship between stress and other chronic conditions that actually functions bidirectionally. They impact each other so that we can start using the really incredible suite of tools that we have for one to support the other and vice versa. So with that, I want to stop. I want to once again thank Tammy and IU Health. And I would love to, I think we're going to be answering your questions by text if you've got them. Thanks so much for having us.
Thank you.